Hello, I'm Dr. Naval Mendiratta. I'm a consultant rheumatologist working in Fortis Hospital, Gurgaon. And today, since it's a rheumatoid arthritis awareness month, so I chose to talk about rheumatoid arthritis. Rheumatoid arthritis, I chose this topic because it is important to make people aware that why this disease has to be diagnosed early. It affects the younger population, especially the females in the age group of 20 to 40. And it's always a myth that the arthritis affects mostly the older population, but that's a bit different. That's the osteoarthritis. Why I chose to talk about this topic is that if we diagnose the disease early, we can always control the inflammation in the joints. The joint damage, which we have seen in a lot of pictures, a lot of videos, a lot of people have damaged joints, that can be prevented if we start the treatment early. So it is very important to pick up the signs early and approach a rheumatologist before we can go for the final treatment. So rheumatoid arthritis, why it is caused is always a question, and it is an autoimmune problem. Autoimmune means your body is producing the harmful cells which are attacking your own body. So rheumatoid arthritis is present in the blood. It's not just limited to the joints. Joint symptoms are just like another symptom like a fever, but the production from the cells, harmful cells which are in the body, is the ones which is damaging the joints. And since it is present in the blood, there is a very high chance that if you don't treat it, it can affect your other organs also, like the lungs, the heart, the kidneys, the eyes, and at times even the brain. So it is important that you know about how the disease progresses. What are the symptoms, and when do you have to approach your doctor is a very common question, because you can't reach the doctor every time for some simple joint pains. So with rheumatoid arthritis, the joints pains are very peculiar, which involves the hand joints, that is your MCP joints, the PIP joints, the wrist, the elbows, and it can even involve the lower limb joints like the knees, ankles, but the hand joints tend to come a very bit early. Apart from pain, you will start experiencing swelling of the joints as well. The swelling is something which you can't miss, and it doesn't go off with medicines. That is a very peculiar sign that yes, something is wrong in your body. And the third common symptom is morning stiffness. When the patients wake up in the morning, they experience the morning stiffness, which is more than 30 minutes at least, and you can feel that the ring is getting tight, or you may not be able to form a fist, and even to do the routine activities, it's quite a struggle for you, and it takes at least an hour or so before you resume your normal activities. The thing about joints in rheumatoid arthritis are that they get better with work, but worse on rest. So that is one thing again which goes against the other arthritis. Other than symptoms, it can affect the other organs. You may start having the dry eyes, you may even have dry mouth, you can have problems with the cough which is persistent. So these are other signs which a long-standing rheumatoid arthritis, if uncontrolled, can cause. So which is the population which is at risk? It is very common in the young females in our age group, especially between 20 to 40. They are more prone to develop the rheumatoid arthritis. Although males also have it, but the females have almost 5 times the ratio as compared to the males. Now coming to the treatment, which is very important, and the diagnosis. So the diagnosis doesn't only depend on the labs. A lot of labs, times you may have positive labs but without any symptoms. So it is important you order the labs before that. Your doctor should order the labs with the symptoms. Sometimes you may have swellings but the lab may not pick up, so that again goes in favor of arthritis, but that is something which your doctor has to figure it out. Coming to the treatment, a lot of time there was myths that painkillers always help the disease, but the painkillers do not even help control the disease. They do not stop the inflammation. They are only more toxic to the body when you keep taking them for the long time. One of the common problems in India with patients who develop kidney disease is because of the overuse of these painkillers. Since they were available over the counter, people tend to keep abusing it till then. We have a lot of good drugs now available. There are 2 types, that's the DMARDs. DMARDs, we have few of the drugs. They are started early, and they are the ones which we try to keep the patients on long-term therapy, and they tend to control the inflammation. The 90% of the patients will respond to this DMARDs itself. You may read online about a lot of side effects of these drugs, but always consult a doctor if you have any apprehensions regarding these drugs. Coming to the newer drugs, that is the biological DMARDs. Biological DMARDs has been the new thing which has been coming up since the last 10 years. We didn't have much oral drugs recently, but now the DMARDs, the biological DMARDs, are the ones which help controlling the inflammation if the person doesn't respond to oral therapy. There are a whole lot of variety available, and eventually we prescribe it only when you fail the oral DMARDs or the inflammation is not getting controlled. Steroids, painkillers are the ones which we tend to use the least, because they are cause more of a damaging effect rather than controlling the disease when you take it on a long-term basis. They are given on a rescue therapy but not as a continuous therapy, and most of the time. But the big question every patient asks, is it curable? Rheumatoid arthritis is controllable. It's still not a curable disease. Just like diabetes, just like hypertension, you have to take some medicines. But what we have observed, what the new studies have shown, that if you start the treatment early, within first 6 months of diagnosis, you will be taking the minimum medicines, there will be minimum damage to the joints, and long term you will do much better. You may even do well with a single drug all throughout. So friends, my final word is, whenever you feel those symptoms, don't hesitate to approach your rheumatologist. Rheumatologist helps you classify which sort of arthritis you have, if you need any stronger treatment, or you just do good without any much treatment as well. Thank you.